Video 3. Diabetes. Symptoms, causes, risk factors, complications, and diagnosis. Diabetes mellitus, commonly known as diabetes, is a metabolic disease that causes high blood sugar. The hormone insulin moves sugar from the blood into your cells to be stored or used for energy. With diabetes, your body either doesn't make enough insulin or can't effectively use the insulin it does make. Untreated high blood sugar from diabetes can damage your nerves, eyes, kidneys, and other organs. There is no cure, but treatments allow you to manage your condition. Here in this section, we are going to learn all about diabetes symptoms, causes, risk factors, complications, and diagnosis. So let's get started. Symptoms of diabetes. General symptoms: increased hunger, increased thirst, weight loss, frequent urination, blurry vision, extreme fatigue, and sores that don't heal. Symptoms in men. In addition to the general symptoms of diabetes, men with diabetes may have a decreased sex drive, erectile dysfunction, ED, and poor muscle strength. Symptoms in women. Women with diabetes can also have symptoms such as urinary tract infections, yeast infections, and dry, itchy skin. Symptoms of type 1 diabetes. Extreme hunger, increased thirst, unintentional weight loss, frequent urination, blurry vision, tiredness. It may also result in mood changes. Symptoms of type 2 diabetes. Increased hunger, increased thirst, increased urination, blurry vision, tiredness, sores that are slow to heal. It may also cause recurring infections. This is because elevated glucose levels make it harder for the body to heal. Gestational diabetes. Most women with gestational diabetes don't have any symptoms. The condition is often detected during a routine blood sugar test or oral glucose tolerance test that is usually performed between the 24th and 28th weeks of gestation. In rare cases, a woman with gestational diabetes will also experience increased thirst or urination. The bottom line? Diabetes symptoms can be so mild that they're hard to spot at first. Type 1 diabetes. Doctors don't know exactly what causes type 1 diabetes. For some reason, the immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas. Genes may play a role in some people. It's also possible that a virus sets off the immune system attack. Type 2 diabetes. Type 2 diabetes stems from a combination of genetics and lifestyle factors. Being overweight or obese increases your risk too. Carrying extra weight, especially in your lower belly, makes your cells more resistant to the effects of insulin on your blood sugar. This condition runs in families. Family members share genes that make them more likely to get type 2 diabetes and to be overweight. Gestational diabetes. Gestational diabetes is the result of hormonal changes during pregnancy. The placenta produces hormones that make a pregnant woman's cells less sensitive to the effects of insulin. This can cause high blood sugar during pregnancy. Women who are overweight when they get pregnant or who gain too much weight during their pregnancy are more likely to get gestational diabetes. Diabetes risk factors. Type 1 diabetes. You're more likely to get type 1 diabetes if you're a child or teenager, you have a parent or sibling with the condition, or you carry certain genes that are linked to the disease. Type 2 diabetes. Your risk for type 2 diabetes increases if you are overweight, are age 45 or older, have a parent or sibling with the condition, aren't physically active, have had gestational diabetes, have high blood pressure, high cholesterol, or high triglycerides, have pre-diabetes. Gestational diabetes. Your risk for gestational diabetes increases if you are overweight, are over age 25, had gestational diabetes during a past pregnancy, have given birth to a baby weighing more than 9 pounds, have a family history of type 2 diabetes, or have polycystic ovary syndrome, PCOS. Diabetes complications. High blood sugar damages organs and tissues throughout your body. The higher your blood sugar is, and the longer you live with it, the greater your risk for complications. Heart disease, heart attack, and stroke. Neuropathy, nephropathy, retinopathy and vision loss, hearing loss, foot damage such as infections and sores that don't heal, skin conditions such as bacterial and fungal infections, depression, and dementia. Gestational diabetes. Uncontrolled gestational diabetes can lead to problems that affect both the mother and baby. Complications affecting the baby can include premature birth, higher than normal weight at birth, increased risk for type 2 diabetes later in life, low blood sugar, jaundice, stillbirth, and the mother can develop complications such as high blood pressure, preeclampsia, or type 2 diabetes. She may also require cesarean delivery, commonly referred to as C-section. The mother's risk of gestational diabetes in future pregnancies also increases. Diabetes diagnosis. Anyone who has symptoms of diabetes or is at risk for the disease should be tested. Women are routinely tested for gestational diabetes during their second or third trimesters of pregnancy. Doctors use these blood tests to diagnose prediabetes and diabetes. The fasting plasma glucose (FPG) test measures your blood sugar after you've fasted for 8 hours. The A1C test provides a snapshot of your blood sugar levels over the previous 3 months. To diagnose your gestational diabetes, your doctor will test your blood sugar levels between the 24th and 28th weeks of your pregnancy. During the glucose challenge test, your blood sugar is checked an hour after you drink a sugary liquid. During the 3-hour glucose tolerance test, your blood sugar is checked after you fast overnight and then drink a sugary liquid. The earlier you get diagnosed with diabetes, the sooner you can start treatment. Some types of diabetes, like type 1, are caused by factors that are out of your control. Others, like type 2, can be prevented with better food choices, increased activity, and weight loss. Discuss potential diabetes risks with your doctor. If you're at risk, have your blood sugar tested and follow your doctor's advice for managing your blood sugar. Remember, there is no cure for diabetes, but it can be treated and controlled. Thank you for watching. See you in the next video lesson.